Let's now get you the recent updates from Sweden, as the death toll in Sweden now far exceeds that of its lesser populated neighbours. Sweden has admitted that it may have taken a big gamble when the country bucked the trend in Scandinavia and opted never to impose any kind of lockdown in the country to counter COVID-19. Sweden now is facing criticism after its big failure to prevent the deaths of the elderly from coronavirus. The virus notably is tearing through the country's nursing homes. Anders Tegnell, Sweden's state epidemiologist, says that he made the wrong call on the country's coronavirus lockdown. Tegnell admits that too many people have died after he shunned mandatory rules. Speaking to a local radio station in Sweden, he agrees with the interviewer that too many people have died in Sweden. And asked to battle the same disease again with the benefit of hindsight, Tegnell says that he would have imposed tougher restrictions to slow down the spread of this infection. However, he still believes that full lockdowns seen in other European countries during the outbreak were unnecessary. The Swedish government chose to ignore advice from countless health experts to lock the country down. Officials relied on people voluntarily practicing social distancing and opting to work from home. The responsibility of not spreading the virus was put squarely on the shoulders of the citizens instead of the government, and the state epidemiologists kept things largely business as usual. Primary and secondary schools, restaurants and shops remained open, and gatherings of up to 50 people were still allowed across Sweden, even though cases were on the rise. The Scandinavian country now has the highest per capita death rate in the world, 4 times higher than that of its Nordic neighbours, who did in fact impose lockdowns. Last month, figures from the Swedish Statistics Office showed that more Swedes have died in April than any one month for 19 years. About 90% of the deaths were of people in the age of 70 years and those who were living in care homes.